Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today we have a very special guest on our program.
Thank you.
Tara. So Tara is a patient of mine who we did surgery on 5 months ago, but also a good friend of myself as well as our entire family.
Yes, we love your family.
So Tara's 5 months out from her surgeries. We did a multiple procedure case. So we did facelift, deep plane facelift, deep plane neck lift, upper eyelid lift or upper blepharoplasty, lower eyelid blepharoplasty. We did fat grafting, and then finally we did CO2. So lots of procedures, all to kind of harmonize the results at the end. So we're going to dive right into questions.
Go.
Thanks for being here. First question is, what was the why now moment? Like, when did you decide, okay, I think I'm going to do this facial plastic surgery thing?
Yeah, so that was a journey for me, as you know. Yep. I actually had 2 consultations with you. Yep. I had one, and then at that point it was the lifting in the mirror. Like, you just always found yourself lifting. But I guess I just wasn't quite ready yet. So I came back about a year later, and at that point, everything just felt like it was coming down.
Yeah.
Everything was coming down. The makeup wasn't staying where it was supposed to be. It was just time to get everything more youthful looking.
Yeah. And this is a common thing. I think, sometimes that first consult, we'll do the consultation, and I think that patients are almost ready to kind of pull the trigger, almost ready to do the surgery. But then there's kind of that, like, let me think about it for a few months and make sure that this truly, I like what I heard, but let's make sure this truly is the right decision for me. We see that all the time.
It's a big decision, not just for me, for my family, and working that in within the scheduling of your family, and just kind of mentally wrapping your head around, how's this going to go? How's it going to be when I'm all healed?
Right.
There's a lot of questions that you just have to mentally get yourself prepared for.
Absolutely. Yep. And Tara's kids are a little bit older. I mean, they're not, 4 years old. So there wasn't necessarily like that.
Yes.
I have to hide what I'm doing from them.
Correct.
But there's still that, day to day, taking, kids to school or commuting to college, and, just being a mom at the same time, that has to obviously come into the timing of when you're going to do the surgery.
Well, absolutely. And also I have 3 boys, and it's very important with boys, like girls, that they learn to love themselves.
Yep.
Right. And then here I am getting ready to go and not change my appearance, but turn the clock back on my appearance.
Yes.
So I sat each one of them down, and I had a conversation with them and said, this is what I want to do. How do you feel about that? I'm not doing this because I don't love myself. I'm just seeing some aging that I would like to reverse a little bit. I'm not going to look any different.
Yep.
I'm not adding anything. I just want to appear more youthful. And they were all on board 100%. And that was really important to me, because if my boys weren't going to accept it and support me, I probably never would have done it.
And that's incredibly insightful. This is actually the first time that I've heard that in terms of having that conversation, whether it be with your spouse, your kids, maybe your parent if you're younger, and actually sitting each one of those individuals down for a one-on-one conversation. I think that's brilliant, and something that, if people ask me in the future, I'll pass that along to them.
It was really important to me.
That's incredible. How did you choose me? How did you choose my practice, our surgery center? What was that journey like?
Obviously we love you. I know you.
Yep.
What stuck out with me most in all the consultations is how very patient you were, and how quick you were not to be like, you need this done. You need this done. You need this done. After our first consultation, you actually said to me, I wouldn't do anything except your eyes.
Yeah.
And I was like, if we're doing this, we're doing this, right? And I think that was like, oh, okay, well, that played into my decision of, well, maybe I'm not ready to have everything yet.
Yeah.
But you were so patient, and just everything was about enhancing, not about making you, that's such a bad way to say it, making you look better, but just enhancing and turning back the clock a little bit.
Yeah.
That was super important to me. The support of your staff was very, very important to me.
Yes.
They were all fantastic with the the follow-up, what they could do for me. They were always 100% available to me, as were you. And they all made that very clear pre-op and post-op.
Yep.
So it was kind of a no-brainer.
Yep.
It really was. And I was comfortable with you.
Right.
Which is very helpful because a lot of times you have a surgeon and yeah, it's great, but then you never really see him again unless something goes wrong.
Right.
And I just wanted to know that my relationship with my surgeon was going to be, we both had the same goal.
Yep.
Right. And we wanted the same aftercare plan as well. And I felt like that made us a good team as well with Luciana offering, all the concierge aftercare.
Yep.
That was
Yep.
get Luciana for your aftercare.
Yeah, so a lot of good points there. So obviously you have to have trust in the surgeon, right? And if the surgeon can't, by the end of the consult, I think give you that trusting, warm feeling, that's probably not the right fit.
I would agree.
And really, other brilliant point was the staff, because I think that a lot of patients going into the surgery don't really quite realize just normal questions, but how much attention to detail that we need to give our patients after the procedure, and quick responses to our patients, and making sure that we're always available.
Yes.
Those first couple weeks, it's a lot. It's a lot, and if you don't have those advocates on your side, it can make the healing definitely a little bit scarier.
Absolutely, because I don't know what's normal. I don't know how something should feel, how something should look. I don't know that. I've never been through this before. And you can Google till your heart's out, and everybody's journey is totally different.
Yeah, that's right.
But when I can pick up the phone and Portia's like, send me pictures. Oh, no, that's totally fine. Or, you know what? Maybe we should take a look at that. I don't know. That was fantastic.
Yeah. Yep. So very good point. And we do offer the concierge nursing. So that's another good point. And those are our own nurses, the same nurses that are taking care of our patients before, during, and after the surgery. So they're going to know the ins and outs of these procedures a lot better than, say, just a third party that's just kind of picking up that night shift to help take care of our patients. Okay, now, this is what I think our audience probably really wants to hear.
Okay.
Be totally candid. What was the recovery process really like? Like, what were the things that happened you didn't expect? What were the challenges? What was maybe better? All of it.
Okay, that's a really good question.
Yeah.
So I started one day pre-op keeping a video log.
Awesome.
Of everything. Because if I were to answer your question, and I looked at all that last night, and before that I would have been like, oh, are you kidding me? That was the easiest thing on earth. Why isn't everybody just doing this? And it still was very easy. But as I went through and I looked at it, I was like, oh, day 3 was a rough day. I didn't really realize that. So I was probably home in bed on surgery day by 3 o'clock, maybe. Felt great. And I will stand by this. I never had any pain.
Yeah,
ever.
you told me that.
Never had any pain. That wasn't because of the medication.
Right.
Because I didn't take the medication.
Yeah.
I took Tylenol. There just was no pain.
We got 3 boys, so this is
Yeah, right. That's nothing. It was fantastic. I would say the most, oh my gosh. The one thing that stood out at me when I was watching the videos is how much pressure support I felt through here. Like it felt like I had a very tight chin strap on.
Yep.
And even today, almost 5 weeks out, it's light pressure. I feel very supported, but I guess I didn't realize going through it, that wasn't very comfortable.
Right. Yeah.
That
little
wasn't
unnerving.
comfortable.
Yeah.
Yes. And I remember you preparing me with this is if you're claustrophobic, it might get you.
That's right. Yeah.
It didn't get me to that point at all. The worst part of it was that darn head thing, the head strap.
Yep.
That was the worst part of all of it.
Yeah.
All of it.
Yep. And I think that's a pretty typical thing that we hear with facelifts, neck lifts, especially, is its tightness. It's like if we don't counsel our patients beforehand and tell them you're going to feel tight, this is going to be maybe a little bit of an anxiety-provoking experience, then they might not be prepared for it, because it shouldn't be painful per se.
No pain.
Yeah. So, but she's a tough cookie for sure. So at what point, like how many weeks out, did you feel like you were like, okay, I'm starting to kind of like what I'm seeing here? How long did that take to process?
See, I feel like, I hope I'm the norm. I was at Parents Weekend 4 weeks later in Arizona for my youngest son.
Yeah.
On the plane. And everything looked so good that he didn't use. I'm like, so what do you think? He's like, about what? And I'm like, I had it done. And he's like, oh,
Yeah.
you just look like you. And
Yeah.
I was like, oh, that's awesome. That's perfect. Like to me, I'm seeing the swelling.
Yep.
I'm still seeing the slight discoloration, even though I really didn't bruise. I'm still seeing that. I'm
Yep.
seeing the swelling in the eyelids.
Yep.
And my son was like, no, you look great. Didn't even notice.
Yeah.
In a good way, not in a
Exactly.
bad way, right? But I would say, I mean, if I had my surgery on Wednesday, I was walking the dog the next day.
Yep.
It didn't, nothing slowed me down. I got more tired, but it was probably 2 weeks that I started taking picture and I was like, oh, there it is. There's the chin.
Okay.
There's the eyes. I can
Yeah.
see it. I see the vision. I can see what's going to happen.
Yeah. And obviously everyone's different. Swelling can persist longer in some people than in others. But one of the key lines that I make during the consultation is that most of the things that my patients are seeing at 3-4 weeks after surgery are things that other people aren't picking up on, right? You could go to a dinner at 3 weeks and no one in the world is ever going to look at you like, oh my gosh, what did she have done?
Absolutely.
You're going to see some swelling that people won't appreciate. You're going to feel swelling. And so then you think that they're looking at you because you're feeling the swelling.
Yep.
But typically by 2 to 3 weeks, people aren't paying attention to that stuff anymore, except for my patients themselves.
And there's nothing visible on your face to
Yeah.
be like, oh, what's going on there? There was nothing.
Right.
There was
Yeah.
nothing.
Yeah, that's exactly right.
Yeah.
So one unique thing about Tara's case, compared to some of my or most of my aging face cases, is that with the upper eyelids especially, so this kind of distinguished her case, Tara reported to me that she actually really always, as far back as she could remember, had hooded eyes. And so she never really was kind of seeing that nice, beautiful, she has beautiful eyes, and she wasn't ever seeing that nice brightness, openness of the eyes. So that was kind of the exception, that we weren't just turning back the hands of time. We were actually doing something that she probably always, wanted. Maybe we weren't thinking about it daily, but when we had the consultation, she's like, oh, that would actually kind of be nice.
Yeah.
So above and beyond just turning back the hands of time for that particular case.
Absolutely. I've always had hooded eyes. It's just a hereditary thing in my family. Everybody has them,
Yeah.
which is fine when you're
Yeah.
20. When you're my age, it's not so fun anymore.
Right. Yeah.
But even to this day, people will always be like, oh my gosh, your eyes.
Yeah.
And it's like, oh,
Yeah.
yes, thank you. Thank you.
And that may be why we started that conversation way back when with our first consult of, if you're going to do one thing, do the eyes first if you're thinking about staging it or you're not quite ready for the other procedures, because, eyes, in my opinion, it can make, probably the biggest difference, just because that's what we're looking at when we talk to each other in conversation. People are going to notice those eyes, and it really opened up, like I said, her nice, beautiful green eyes. So, yeah. Well, thanks for being here today.
My pleasure.
Thanks for being candid. I hope you guys liked what you heard today. If you did, please like the video and be sure to subscribe to our channel.